Anatomy is the course that makes even smartest medical students panic. I believe you also know that, because you need to learn hundreds of muscles, thousands of nerves, and even endless blood vessels. And let us not even talk about the brachial plexus. But here is the truth: you don't have to burn out because you want to pass anatomy. I personally knew this because I also did it, and in this video I'm going to share with you how exactly I passed my anatomy without losing my mind, without losing my sleep, and even without losing my social life. At the end of this video, you are going to learn my strategies which can save you from endless all-nighters and even make anatomy more enjoyable for you. Now here is the problem: why anatomy feel impossible. Hello, my name is Dr. Salisha Ebu, a senior resident doctor specializing in public health. If you are coming across my videos for the first time, please do well to subscribe to the channel, like and share the video to anyone that you feel might benefit from what I share on the channel. Let's proceed. Now, what's the problem with anatomy that most students feel panic whenever they hear about anatomy? Let's be real here. Anatomy feel impossible for these three reasons. Reason number one, the volume of the content. Yes, I can remember when I started reading anatomy at my year 2, when I come across the voluminous content in one of the textbooks, the atlas that I used then, I myself was scared. So you feel like, can I be able to memorize all what is inside these textbooks? And another reason why anatomy scared a lot of students is that many students tend to cram whatever they read in anatomy textbook, and within few hours whatever they read will evaporate as if it will just evaporate from their brain. And the third reason why anatomy feel impossible is most of our professors pay attention to details. They expect you to study and pay attention to any tiny details of an artery that you might not even hear about it again in your career journey. And when you try to handle all this by force, you end up burning out, you end up depriving your sleep, become anxious, and still become confused. All this happened to me at the beginning of my year 2 until I realized anatomy is not all about cramming. It is all about strategies, and these are the strategies that I'm going to share in this video. The first big secret is that don't try to learn everything at once. Learn in layers, and this is what I mean. For example, first layer, get the big picture of whatever part of the body you are reading. For example, if you are reading about the heart, know that the heart pumps blood to all parts of the body. Don't bother to know the name of any artery yet. With this, you know the broader picture of what our heart is all about. Then you now move to the second layer, where you will now be adding more details gradually. For example, here you can pick the main coronary artery and learn everything about it. And for example, the third layer, this is when you go deeper only when necessary. For example, when you are preparing for exams, or if you want to know the clinical relevance of whatever part of the body you are reading. Most students dive into the deepest details of whatever they are reading and they end up being drowned later. So build your knowledge in layers. You can go broad first, then become specific later. So here is my second secret: active recall. Reading your anatomy textbook 10 times might not work for you. Anatomy work when you test yourself, and this is the strategy that also helped me during my medical school days. So here is what I did. If for example I'm reading about a bone, I draw a sketch about that bone and label them off health without looking at my textbook. And secondly, I use teach back method. Whenever I read about any part of the body or any modules, any nerve, I explain it further to any of my friends, my colleagues. So whenever I read any part of the body, like any artery, any muscle, insertion and origin, I try as much as possible to explain whatever I read to any of my friends of health. I even used to go ahead to even explain to some of my friends who are not even in medical school. So what did I mean here? Whenever you recall instead of rereading, your brain tries to move that knowledge into a long-term memory area, and if you are asked in an exam about that thing, you are likely going to reproduce it back. So therefore, even if you don't like drawing, try and be tracing a diagram and be filling the names. It works wonders. Start trying it today. The third strategy that helped me was connecting anatomy to clinical realities. Connect any part of the body that you read to a real life patient. If you make anatomy to feel like an abstract thing, you will easily forget it. But once you tie it to a patient, it usually sticks to your brain. For example, the facial nerve that you read is not just a line on the diagram. This is, you can connect it with, this is why patients with Bell palsy cannot smile. Or you read about phrenic nerve, you can connect it to, this is the reason behind someone who has a neck injury find it difficult to breathe because of affectation of a diaphragm. Or you read about femoral artery, you can connect it to, okay, this is where doctors check for pulse, for example, in patients who are involved in trauma. So when I started linking anatomy to a real patient, I stopped becoming became boring, and it eased my memorization, and it even became my language of medicine for me. And finally, I would like to share some of the resource material that saved me during my medical school years. YouTube channel like Anatomy Zone, NinjaNet, all these channels helped me during my preclinical years. Atlas textbook like Netter's Atlas, this is my best atlas. I don't read without Atlas. Yes, I don't read any anatomy textbook without Atlas. So finally, I would like to summarize some of these strategies that helped me during my medical school days. So in summary, this is how I passed anatomy without burning out. Number 1 is I learn in layers, not all at once. Number 2, I use active recall. Number 3, I connected anatomy to a real life patient. And finally, I use some resources like Netter's Atlas, YouTube consistently, and they all help me in passing my anatomy exams. I can guarantee you that if you apply all these my strategies, you will not going to pass anatomy, you will actually understand it. Now I want to hear from you. What part of anatomy was the hardest for you? As for me, the hardest part of anatomy was neuroanatomy. So is it bones? Is it when you are reading about muscle? Is it about nerves? Which one among these is the hardest for you whenever you are reading anatomy? Drop your answer in the comment section. Let's see how we can go about that. If you found this video helpful, don't forget to like and subscribe to the channel, and do well to share with other medical students who also need it. And finally, thanks for watching, and remember, you don't need to burn out to succeed in medical school. There are strategies that can help you in medical school, and this is what I am here to share with you. See you in my next video.